clearly we've been talking a lot about the inputs that really drive quality food as medicine projects, and certainly policy is core to that. So we're pleased to have with us today Katie Sawyer, who's the state director for Senator Roger Marshall, and she's going to provide us a quick overview of kind of the bird's eye view of federal legislation.
Good afternoon, everybody, and thank you for the opportunity. I see a lot of familiar faces in the crowd, which is great, but a lot of new faces. So I think Alyssa's presentation, as Brandon said, was a great overview, and she really eloquently encompassed all that is food as medicine. And so hopefully I can then add a little more depth to this. Perfect. My name is Katie Sawyer. As Brandon said, I serve as state director for Senator Marshall. I live in McPherson County, and so have been with the senator through his duration of time in Washington, D.C., so have kind of gotten to see the evolution of this particular concept, I want to call it, as he started back in 2017, and as it's moved through different administrations, and the national conversation around this topic has really picked up to the point that it's something that now he's going to conferences and talking about. The nonprofit world's very involved, and so I'm sure you guys have all felt that too, but it really has gained momentum, which is really cool. To give a bit of perspective for those of you guys who do not know Senator Marshall, born and raised in Kansas and Butler County to be exact, and then went to medical school and served as a physician, specifically in OBGYN, for 25 years out in Great Bend, Kansas. In addition to having his own practice and helping run a hospital, he served as the medical director for multiple county health administrations. And so he got to see both the private and public-facing side of healthcare. Being an OBGYN, he interacted with pregnant women a lot. And it's through that lens that he realized how important the nutrition component is for women, both that are pregnant and, postpartum, but also his older patients as well that may be dealing with osteoporosis from something as simple as a lack of calcium in their diet. And so he came to Washington, D.C., maybe with not food as medicine as like, that's my topic, but with this idea of, I'm a physician, I served in a rural part of the state, and I see the link between the two. His wife was very involved in the food bank there, in their communities. They did a lot of local outreach, and so he saw all the pieces, and I think coming to DC gave him the opportunity to kind of, connect it all together. So, he started talking about this. He wasn't on a committee of jurisdiction for healthcare necessarily in the House, but we have moved on to the HELP committee, which is Health, Education, Labor, and Pension in the Senate. So now he sits on the Agriculture committee and the HELP committee. So as Alyssa mentioned earlier, it is both the healthcare component, but also the food sourcing component that we really emphasize when we talk about this topic. Just to kind of give you guys a brief roadmap of where we're going here, food as medicine when it comes to the senator's work is a multi-agency approach and sub-agency. I recognize the FDA is a sub-agency, but just to give you guys a kind of a quick idea of where we go with this topic, we go from USDA over to HHS and then FDA, as FDA does play an important and growing role, I think, in some of the food access, and as we get into more specialized foods, they're going to be the governing agency we're going to have to go through for some of this stuff. So really trying to do outreach to all these agencies and working through the agencies and the programs that are already established to do a really multi-pronged approach to giving more people access to healthy foods and creating the healthy food environments within communities. As a member of the House, just to give you guys kind of a little background, he founded the Food as Medicine Working Group. That was kind of the first step to say, I think this is a thing that we can talk about. There are actually several healthcare providers in Congress, both in the House and the Senate, anything from nurses to physicians, eye doctors. So there was a natural group of folks who kind of understood this topic and maybe just hadn't come together. And then they picked up other folks along the way who had more of the nutrition side of it. And so it was a cool concept. And he then helped lead bipartisan legislation. It kind of started with his work in the House on the pilot the medically tailored meals program that Alyssa referred to. He's continued that in the Senate. And then the 2018 Farm Bill that we helped pass can't be overlooked as a vehicle for food access and starting diversify our food networks in different parts of the state. Alyssa kind of referred to this, but the National Institute of Health has really kind of taken this on, and they've kind of started putting this as kind of one of their mantras, and so we were really happy to start seeing that. And they have now a 10-year strategic plan that they're working under to help guide some of their work. So as Alyssa said, this is making its way through the administration and through the agencies, which is good because it's inserted in all the conversations. The senator, kind of likes to think of everybody as his patient, and so he's looking for ways to continue to make sure that, everybody, no matter where they're working, is impacted by this particular issue. Skipping ahead here. The Office of Disease Prevention and Health also has kind of picked this up. So within HHS, we have a lot of sub-agencies that are kind of working through this. I wanted to include a kind of a note in here. We talk a lot about really complex diseases, and that is something that can be addressed, but something as simple as obesity and diabetes, which are both growing diagnosis within the American population, are becoming bigger issues within our healthcare system. Not only the nuts and bolts stuff of do we have beds to fit larger size patients, but when you talk about the fiscal bill that it is adding to our healthcare system to take care of people with pretty simple diagnosis that can be managed through diet and exercise, we're talking about the $16 trillion that it cost between 2011 and 2020. And then you want to kind of, domino effect that can be attributed to our national security in a way, because the fewer people that we have eligible for the draft, which is a lot of times a physical limitation of some sort, the fewer people we have to serve our country and protect our country. And so you can start connecting the dots really easily that if we don't get some of these common conditions under control, we have larger problems that are both fiscal and otherwise. So to kind of go through some of the agency-specific work, HHS is a big piece for us. As I said, we serve on the HELP committee, so we have access to the agency. We work well with the staff. And two of the things that we have worked on is the National Food as Medicine Strategic Plan Act. Obviously, we've gotten a lot of that kind of implemented in different ways. And then the Community Health Center Nutrition Act as well. I'm sure some of you guys are familiar with that who work at our CHCs. But we see CHCs, and the senator has visited several of your facilities here in the state, and hopefully we get to more this year. But you guys touch a great swath of the population, and you have the tools and the resources to hopefully start doing this. And we were able to see, there he is, Matthew Schmidt's, Food as Medicine pilot program this last summer about how he's working with patients with diabetes and working with the high school and community. You guys are just so great about thinking out of the box and, how do we bring our resources together and, all this kind of stuff. And so, really encouraging and trying to give the CHCs of the world the resources they need to continue their work. As Alyssa said, we are one of the original co-sponsors of the Bipartisan Medically Tailored Meals Demonstration Act. I will put a note in here that everything that the senator does in this space is bipartisan in nature. There really is, as she said, we may come at it differently in terms of how we look at solving the problem, but we all want to get to the same solution. So he's worked really hard to find partners across the aisle to make sure that this is bipartisan. And that helps everything just in a very realistic world move forward. That if it was a Republican-only bill, it wouldn't move, especially in a Democrat-controlled Senate. So when you talk about just being pragmatic and getting stuff done, you have to be bipartisan in nature, and he's done that with all of his bills. And then the Nutrition Real-Time Benefit Tool Provider Act. I'll let you guys read that, but that's another tool that they can use. Moving on to the FDA. The FDA can be a great resource. It can also really cause some stumbles as we move through the regulatory process. And so the Human Foods Program, this came about following the infant formula shortage that I'm sure a lot of you guys felt impacts from if you interact with the WIC program at all. And so we worked with the FDA to now establish a human food program as a result of what happened with that formula crisis. And so really proud about that work. And then they have a food czar at the FDA now. And as you can see, the title of that slide is putting the F back in the FDA. We hear a lot about their oversight of the drug, but the food part of it too is going to be instrumental moving forward. And so having that relationship with the food czar at that agency is very important and something we've really prioritized. And Jim Jonas, I don't know, yep, it is in there. Jim Jones, excuse me, is the food czar there if any of you guys have interacted with him or been on calls with him. Moving on to the USDA, which we have oversight of through our seat on the Senate Agriculture Committee. And the USDA plays the part of not only some nutrition programs, but how we can start providing more fresh fruits and vegetables in our communities and getting that direct back to the producer access to some of these foods and getting the farmer involved in these conversations. The WIC Healthy Beginnings Act, obviously we're a huge fan of WIC. We had one of the USDA officials out this summer. We were in Manhattan, I believe, with the senator and had a great roundtable discussion. I don't know if anybody here was involved in that, about the WIC program and really boosting the WIC program and making sure it's working for all mothers and infants. So big proponent of that program. Once again, as an OBGYN, he saw the absolute necessity of that program. More options to develop enhanced remote nutrition in WIC. Telemedicine, as Alyssa said, is key in all of this. And as we got new technologies, part of our emphasis is keeping those technologies going. We learned a lot from the pandemic, good and bad. And what we learned is a lot can be done over a screen if the patient and the provider are willing to engage in that formula. And so we want to make sure that those pathways are there. And then recognizing the value of frozen foods in WIC. Little things like that that make a big difference, especially as we get into our more rural communities where the access to some of the fresh fruits and vegetables is limited. Frozen has the same nutritional benefits. And in a lot of ways, it's better for some of these families who can't immediately get, I mean, look, I buy bananas for my family every week and I throw half of them away because we don't eat them. And so the frozen component of it allows for a more shelf-stable option, but unfortunately it's not included in the WIC program in some ways. And so little things like that to help grow the access. Also within the USDA, the Beefing Up Whole Milk for Healthy Kids Act. If you've seen the senator on TV, it's more than likely he has a cup of milk in his hand and he's drinking milk while he's talking. He loves to talk about the benefits of whole milk. That goes back to his conversations with his older patients. We don't drink milk anymore. We are lacking calcium in our diets. Simple things like that can help the average person maintain, bone density and some of the health components that they need. So little things like that, but getting that back into the schools and getting our kids reacclimated to drinking milk is very important. And then the Dairy and Nutrition Incentive Program, once again, beefs up some of the dairy options through the SNAP program. We oversee the SNAP program as part of the Farm Bill, and so we talk about it a lot. I know we have some differing opinions than some on the SNAP program, but it is a necessary component of an overall food system for many of our folks. GusNet program, many of you guys are familiar with that. We're following a lot of the pilot projects. We'll continue to follow those and see where that program can go. And then adding water to my plate. We don't drink water anymore. We drink a lot of other things, and so simple additives like that can help with sound nutrition. And then Farm Bill priorities. For anybody who doesn't follow ag policy, the Farm Bill was supposed to be reauthorized last year. It was not. We put a one-year extender on it, and so it technically expires at September 30th of this year. The Farm Bill has a lot of valuable components of this overall food as medicine conversation. And so as we continue to work to write a new Farm Bill, we are looking to a couple of the programs in there as part of our work on this. And so you can see here, in addition to SNAP, the Commodity Distribution Program, which is vital to a lot of seniors, and then the Senior Farmer Market Nutrition Program are both part of the Farm Bill, both, I think, components of this conversation. A couple other things, Alyssa hit on it nicely, but if we want to have more access to fresh foods and vegetables, allowing our producers and people who want to be producers to grow more of that in urban settings or just wherever they live, there are programs out there within the USDA and under the Farm Bill that allow them grants and loans and opportunities to expand those businesses. We are seeing a lot, like especially in the livestock sector, a lot of people who are selling their beef now direct to consumer. How do we get more of those folks who can grow some specialty crops, some fruits and vegetables, that ability to sell direct to consumer? Give some of those, build some of those relationships at the community level, and there's resources to do that. And then looking forward, so it is an election year. I don't know if anybody's watched TV lately, but we have a presidential election coming up. So Congress's work is going to be limited, and anytime you have an election year, you have members who need to go out and campaign. That's just the nature of it. So we're looking at what is probably a shortened session this year. Anything past about June, it's just people are kind of have their sights set elsewhere, and so we're looking at a pretty short time frame to get some of this done. We're optimistic with the bipartisan nature of most of our legislation. We can get it done and across the aisle. That does mean that it has to pass in both the House and the Senate, and it has to get to the president's desk and he signs it. To give you kind of a play-by-play on all of them, I don't have that, but we will be continuing to push the legislation however we can, whether that's embedded in another piece of legislation or a rider to something. The senator is working on, as the ranking member on the HELP committee, a hearing specifically on the food as medicine topic. So we are continuing to bang the drum on the topic, hoping that that momentum continues to move forward for us. And then the Farm Bill, as I mentioned earlier, will need to be either reauthorized or extended, and so we'll see what that takes us, but that'll continue that. I was having a conversation with Karen, and she brought up a good point. There are two pieces of any piece of legislation. There's the authorizing legislation. It authorizes and writes the programs, and then there's the appropriation piece, and so we hear about government funding. The authorizing and the appropriations don't usually run in tandem. They run at different speeds, and so as we're hearing some states with the WIC program, they're running low on funds because we reauthorize programs and then we fund them, but they're going at different paces and at different times, and so there's a lot of nuance in some of this that, we really try to work out, but, it's government runs how government runs, and Congress kind of does things on their own time frame, and so some of it's not perfect, but we're continuing to do what we can to keep the trains moving and make sure, programs are funded and there's authorization that continues. So thank you, everybody. Here's my contact information if you need anything from me. Happy to answer any questions.
Yeah, questions for Katie. Yep, coming up front.
Hi, Katie. I'm Donna McClish with Common Ground Producers and Growers out of Wichita.
Yes, ma'am.
Got two questions. First of all, USDA increased senior market vouchers this year from $35 to $50. That was awesome.
Good.
Incredible for our seniors. Do we see another increase coming in with the new Farm Bill and the appropriations?
So one of Debbie Stabenow is the chairman of the Senate Agriculture Committee, and her two projects are specialty crops and nutrition programs. So I think it is on her priority list to see those benefits continue to be enhanced. Now, once again, she doesn't write the check for those, and so we can request through authorization, authorizing a higher level, but that doesn't mean the appropriators come in and do that. But I do think there are enough people who see the benefits of the program that we could see another step up in that.
Well, then that adds a third question. Specialty crops. Is there a mechanism in the Farm Bill for increasing funding directly to farmers that are growing specialty crops? And I know that you probably can't answer that question just right off your head, but something to think about. Right now, we're going through different agencies and money's not getting to where it needs to go to the farmer. So that would be something to look at. And I'd appreciate the senator taking a look at that.
A quick note on the specialty farms. And so crop insurance is something that is applied to the commodity crops, the corn, the wheat, the sorghum, all of that kind of stuff. And it's a much needed product, as we've seen with this Kansas winter, to protect against Mother Nature and all her many personalities. Specialty crops do not have most specialty crops do not have the same level of protection. So when you ask a producer to take acres out of a crop that they can insure and put it in a non-insured specialty crop, and I know there are umbrella programs and some of those, but they don't work quite as well, especially in states like Kansas where we talk about really vulnerable conditions. So one of Chairman Stabenow's priorities is to try to expand crop insurance to cover more specialty crops. Now, the insurance is a public-private partnership, so you're going to need to have private, underwriters who are willing to write those. But that is one of her priorities that she actually released a Dear Colleague letter just a few weeks ago talking about her desire to continue to expand those programs. I think we're in favor of it. The question is going to be, can we get the cost down to a level that a producer is going to be able to afford? Because we're talking about a much smaller pool of people that we're insuring what's a much more vulnerable crop, and so the government subsidies are going to have to be greater, or the the farmer's going to have to pay more in premiums.
We're going to have to start to share subsidies with those
Yeah,
farmers.
yeah,
That's right.
but there is more emphasis on specialty crops and trying to create more food hubs, and there's a lot of those programs. COVID allowed for a lot of the growth of those programs, and that's why I could see the Farm Bill continuing some of those.
Third and final. WIC is not available in Kansas to be used at farmers markets.
Okay,
How can we change that?
that's a good question. I will have to do some research on that.
Thank
but
you.
Yes, I will look into that for you.
Okay. That's it. Thank you.
That is a great question, Donna, and that's something that we can, next time we meet again,
Yep.
maybe we'll have Katie back and she can tell more. Oh, another question.
Nope, false alarm.
Oh, okay.
Yeah. Yeah, it's, it's a substantial investment for most folks, and so they're going to need to make sure they can be properly reimbursed, and they have the markets to sell it into, too. Not everybody wants to go to a farmer's market on Saturday, so how do we provide other vehicles for offloading that produce and getting it connected with the folks who can use it? So,
Any other questions? Katie, that was a really great overview.
Good.
Those were some jam-packed slides.
yes, I'm sorry, I
No, it's great. And they will, as all, will be available on our website with the recording. So that was great. So please join me in thanking Katie for all this great information. Thank you. Perfect.